Okay, at this point I'm going to demonstrate how to don the sterile gown and the sterile gloves. So I have my pre-wrapped gown inside the toweling, and I have my sterile gloves, and I have inspected the wrappers to make sure that the integrity is right and that the size is going to work for me, and that these are sterile and not the non-sterile. Prior to doing this, I would do a 3-minute hand wash, very thorough, to include cleaning my nails, and the rings would need to come off. All jewelry is off so that you are bare below the elbows, as your textbook says. So incredible washing for 3 full minutes. Once I pat dry, then I'm going to come over, and with these two in place, I'm going to open up the sterile wrapping, get a hold of the towel, the gown by its neck, lift it up and away, careful not to touch it on any counters or in trays or on the patient or anything. It shouldn't touch anything. Give it a couple of bounces so that the armholes start to open up and the sleeves. Pull those up. Don't pull the hands through. Bring this over. Now I can use sterile to sterile. And then I can pull my hands through, keeping my chin back. Those of you with long hair have got to tie your hair back in a ponytail before you start this operation, before you wash your hands. Don't touch your face. Now my gown happens to have ties, and I'm going to have to tie those myself. And technically this would be contaminating my gown, but for this purpose, it's in physical therapy, this is what we usually have to work with. So I'm going to get that partially tied back. Now I'm ready to put on my sterile gloves. The gloves, I'm going to open up. The container contains this. It has a wrapper for the gloves themselves. Simply lay those out. It's like a book inside. Open the book. Then get a hold of the interior wrapper on the flaps. Don't touch inside. Bring that out slowly and then pull and buckle it. That's really important right here, that you buckle, so that when I let go, the wrapper stays open. Now I'm going to glove my right hand first. The cuffs here are folded over. The cuff portion would be the part touching my skin anyway, so I don't have to worry about contaminating this part, but I don't want to definitely touch any portion that would be touching the patient. So I'm going to pick this up by reaching inside the cuff, lift it completely off the wrapper, have my hand in supination, and put my hand into the glove slowly. Don't rush this, and don't worry if your fingers don't hit the holes properly. That happened to have gone on very easily, but as I pulled, the cuff started rolling toward my hand, and I get my hand away from it. Don't risk contaminating the glove. Now this is the sterile portion, so we keep sterile to sterile. I can go in from the top here and wiggle this cuff up, and sometimes it takes a little bit of patience to pull the cuff up, get my fingers underneath, and now again in supination I can go for getting my fingers toward the holes, which I don't have those hitting just right, but now I have sterile fingers to sterile, and I can take my time in organizing the fingers. Don't mess with the cuffs. If they don't come up, don't spend too much time dealing with that. You'll contaminate the gloves. And now at this point, I am ready to attend directly to handling sterile items, and I cannot touch anything that is not sterile, and the patient is never sterile. So we would need to have assistance if you need to touch anything that is contaminated or not sterile at this point.